Hi, my name is Brian Noon, RN, Fort Hays State University, and today we are going to be talking about reducing nurse fatigue. At the end of this presentation, you will be able to identify nurse populations most at risk for errors at work, discuss the impact of sleep loss on workplace safety, and recommend opportunities to improve quality and quantity of sleep. I think the first thing in addressing nurse fatigue starts with sleep. And why is it important? It's important for everyone. Why? It's the key to our health, performance, safety, and quality of life. It's an essential component as good nutrition and exercise to optimal health. It's as necessary as the water we drink, the air we breathe, and the food we eat to function and live at our best. I like to think of exercise, nutrition, and sleep as a three-legged stool. You can optimally perform at two out of those three, either excellent nutrition, exercise optimally. If you neglect sleep, you will not function and live to your best. I think to add some perspective, we always start with every lecture we do regarding sleep. We make people think, hey, we're going to do some math today. So let's pretend today is your 60th birthday. If today you turn 60, how many years should you have spent asleep during your lifetime? And that answer is approximately 20 years if you're doing it correctly. So it's obviously vitally important to our overall health. Sleep is essentially regulated by two body systems. The first is the sleep-wake restorative process that balances sleep and wakefulness. That is nothing more than akin to the battery on your cell phone. As soon as you unhook it from the charger and start your day, it begins to discharge to the point where it needs recharged again at the end of the evening. Just the same way, consider sleep as your battery recharge. As soon as you awaken, that battery begins to discharge and you start to accumulate a need for sleep as the day progresses. You can see by the little graph right here, this is following what we call a circadian biological clock, and that regulates the timing of sleep and wakefulness. So if you see the alertness level high and low on the left side of the graph, time of day on the bottom, it's essentially a 24-hour time frame to 9 a.m. to 9 a.m. And this is a person, natural circadian, in the absence of any issues with medication artifacts, sleep disorders, those types of things. But you essentially will follow a rhythm. If you get a good night's sleep, you're going to be fairly awake. You'll hit a mid-afternoon lull or a dip. You'll kind of regain a second wind going on into the evening, and then most people will hit the brakes usually between the hours of 2 and 4 a.m. And that's where we're going to start discussing night shift employees and those folks that try to work off their natural circadian rhythm and some of the issues that they face, not only working off rhythm but also neglecting good quality sleep during the day and the issues that can arise as a result of the same. So your circadian clock, that's the internal mechanism that regulates when we feel sleepy and when we feel alert. It resides in the brain, is affected by light and dark. It's a group of cells called the suprachiasmatic nucleus, which is located near the hypothalamus in the brain. Those cells, those are kind of the alerting cells of the brain. It is affected by light. So light hits the retino-ophthalmic tract, travels up those nerve endings and hits those areas of the brain, causing them to become alert. So light and dark play a huge portion of how we get our sleep, how we trick our bodies into getting better sleep, and how we can improve overall quality of sleep if we use light and dark to our advantage. So sleep, how much? Well, the National Sleep Foundation came out with recommendations in 2016, and this is for every age group from newborn to older adult. So we're going to focus mostly on young adults up to older adults, and the 18 to 25-year-old group of the young adults, 20 to 64 adult age group, and the older adults greater than 65 years of age. You'll notice the dark blue areas are the recommended range. Now, the light blue areas, they could be acceptable, could be appropriate for folks. Some people do not require as much sleep. Some people require a bit more. I always tell people, think of it as a bell curve. A vast majority of those folks are going to fall in those ranges in the dark blue, but there are exceptions. So don't think that if you're not getting X amount of sleep, that's going to be detrimental for you. You have to find what works for you. Sleep medicine is much an art as it is a science, and you have to dig deep and figure out what works best for your particular rhythm. Now, young adults, 7 to 9 hours. Adults, 7 to 9 hours. Older adults, 7 to 8 hours. So you're going to see a theme develop. A minimum of 7 hours is what they have found through research that is kind of the bare minimum necessity for quantity of sleep that a person needs to function effectively at their best. So now that we're aware of kind of the circadian rhythm, what our body naturally likes to do, and we know time frame on sleep, now we're going to discuss what happens with shift work. Now, shift work, I think a lot of people have the idea, or maybe even the misconception, that shift work is 11 to 7. Just night shift. But actually, shift work is any work that's outside the regular hours of, say, 8 to 5 a.m. So if you're even a person who goes to work, such as myself, I'm at work by 6:30 every morning. Technically, I'm doing shift work. So it's irregular sleep times or irregular wake times that are out of phase with that natural rhythm. Now, it naturally leads to difficulty falling asleep. Now, when you work shift and you're trying to sleep off your regular circadian, you're going to naturally have more arousals during sleep. You're probably going to have early awakenings. It's going to be just more difficult. When we look at some of the literature that I've studied over the course of this course, what we find are there have been several studies, and day shift nurses, those that work regular day shift hours, average about 7 hours of sleep a day. Evening shift nurses get about 7.6 to 8.1 hours per day, and this is based on 8-hour shifts. Night shift nurses are the worst, 6.6 hours per day, and then rotating night shift nurses, 5.9 hours of sleep per day. 32% of night shift workers report long-term insomnia and excessive sleepiness. I myself got to the point where I actually experienced sleep shift work disorder, where I could not work night shift anymore. The arousals and the inability to sleep became so great that I would only be able to sleep maybe 2 hours during the day. And that was with all the best tricks that I knew, practicing good sleep hygiene practices and those types of things. It still doesn't work. So 1/3 of our night shift nurses are having issues with their sleep. 32% of all healthcare workers between 2004 and 2007 reported getting less than 6 hours of sleep each day. And we're going to find out why that is so dangerous, not only from a health standpoint for the nurse themselves, but also as a patient safety issue for the patients that we are tasked to care for each and every day. Some more statistics involving the same. 32% of night shift nurses reported nodding off at least once a week at work. So 1/3 of your coworkers, or maybe you yourself, have experienced nodding off at least once a week. Night shift nurses are 1.17 times as likely to make a medication error, 2.1 times as likely to report a near miss medication error than day or evening shift nurses. And I think that number probably is understating it a little bit. I think tired nurses are not even aware maybe of near misses, and sometimes maybe not even aware of the medication errors themselves. Night shift workers are 5.5 times more likely to crash their vehicle on their way home from work. Between 1999 and 2013, an estimated 17 to 21% of fatal crashes likely involved a drowsy driver. And speaking to some of the physicians that I've worked with over the years, in particular one who had gone to a seminar on drowsy driving, one of the issues with trying to estimate the number that are involved due to a drowsy driver is hard because a lot of times, if there's any alcohol involved in an accident at all, even if it's under the legal limit, they will attribute the crash to alcohol. When in all actuality, it could be the drowsiness, the falling asleep at the wheel that could have been the issue causing the fatal crash. Nurses have 3 times the odds of making an error when working a 12 or more hours shift compared to an 8-hour shift. So I think looking at that obviously is an issue that we need to address. I think culturally it's going to be very difficult to get away from 12-hour shifts. 12-hour shifts allow more flexibility for scheduling, staffing. Nurses like to have more days off, although the literature has found that nurses who work 12-hour shifts are also more likely to burn out. And when we look at the odds of making an error for those nurses working longer shifts, we need to start considering, okay, if it's best practice, why do we continue to do things when we know that we can improve odds of patient safety by doing simple things such as cutting length of shift down? More than 40 hours in a week increases increases your risk for errors by 46%. And with mandatory overtime, our particular facility right now is in mandatory overtime, and they're required to work an extra 12-hour shift per 2-week schedule. So that's putting some people into 50 plus hours a week. So you can see just increased work hours can really increase odds of error. Hospitals with higher patient mortality rates had higher rates of nurses working long hours. So those, when you have those nurses working mandatory overtime, they're getting less sleep, they're working night shift, mortality rates increase. Estimated fatigue-related productivity losses for 4 employers in one study were almost $2,000 per employee per year. I thought this was a really good article that I had found to put some perspective on, okay, well, what's the big deal? 3 times more likely to commit an error. Okay, so an Australian researcher did this study, and they determined there's a 3.4% chance of an error occurring when nurses obtain 6 hours of less of sleep during a 24-hour period. Now remember, if we go back to some statistics, about 32% of nurses surveyed between 2004 and 7 were getting less than 6 hours of sleep in a 24-hour period. So, okay, 3.4% chance. Well, that doesn't sound too bad. So that means if an average teaching hospital with 1,000 nurse shifts per day, so a relatively large hospital, averages this error rate, that's 34 errors per day. Over the course of a year, that's 12,000 potential patients put at risk because nurses aren't getting adequate sleep. When you put it in perspective, when you kind of extrapolate those numbers, pull them out over the course of a year, it's very eye-catching to realize what a potential problem lack of good sleep is for healthcare professionals. So not only are we putting our patients at risk due to lack of sleep and getting good rest, there are health consequences for us as well. And you can see here, Mr. Lack of Sleep to your right, you can have a decline in neurocognitive functioning and performance. You are more apt to exhibit poor health behaviors, poor diet, smoking increases for folks who don't get enough sleep, alcohol consumption increases for those folks who don't get adequate sleep. Diseases that are associated with shift work and short sleep time, and this is usually over the course of many years, 15 to 20 years of constant night shift work. Gastrointestinal disturbances. There's a study out that has increased risk for colon cancer, in particular for nurses who've worked night shift for 20 years plus. Depression and anxiety are more likely. Higher risk for cardiovascular disorders. Increased risk for breast cancer. Melatonin suppression. Melatonin, which is a naturally occurring hormone in our body that you may have seen in the supplement shelf at your local Walmart, our body produces melatonin naturally, only in the absence of light. So these people who are sleeping off shift, trying to stay awake during the night, probably with artificial light going on, and then trying to sleep during the day and maybe not allowing for that total darkness to set in, you have a decrease in melatonin. Melatonin has been found to be a natural breast cancer tumor fighter. So melatonin is vitally important that you uh, are able to produce that in adequate amounts while you are sleeping. Increased risk for development of type 2 diabetes, just chronic sleep deprivation, odds go up for increasing type 2 diabetes. Insulin resistance becomes greater. And then you can just go down the line for the effects of sleep deprivation: irritability, check, that's me; cognitive impairment, memory lapses or lost; impaired moral judgment; severe yawning; hallucinations, symptoms similar to ADHD; impaired immune system; increased heart rate variability; risk of heart disease; decreased reaction time; tremors; aches; growth suppression; risk of obesity; decreased temperature. The list goes on for those of us who are chronically sleep depriving ourselves. Okay, so working greater than 12-hour shifts puts you at risk. We know that sleeping less than 6 hours a day in a 24-hour period puts you at risk. This kind of puts things in perspective as well. Remaining awake for 19 consecutive hours slows cognitive function and reaction times to a level comparable to that associated with a blood alcohol concentration of 0.05%. So not quite legally intoxicated, but very, very close. And I don't know how many of you that have worked the floor who are already working at 12, you were asked to stay over, work some more. My guess is at the end of that shift, you've been awake for greater than 19 hours, especially for those folks who work night shift. Remaining awake for 24 consecutive hours slows reaction times to a level approximately the time in a person with a blood alcohol concentration of 0.1%, so legally intoxicated. So I always tell people, would you want a nurse that's been up all day coming in to work night shift? By the end of that shift, they've been up for 24 hours. In essence, you've got a drunk nurse taking care of you. Not sure that that's something that I would particularly care for. Going back to nurse safety again, some drowsy driving statistics from the National Highway Traffic Safety Administration. There are approximately 100,000 automobile accidents yearly due to drowsy drivers, resulting in 1,550 deaths and 71,000 injuries. Shift workers are at the highest risk. The American Nurses Association in 2011 did a survey. 1 in 10 nurses involved in a motor vehicle accident believed it to be a result of fatigue from shift work. So 1 out of 10 of your coworkers that have been in an accident, most likely fatigue was a contributing factor to that. Studies from the Journal of Sleep Medicine: 895 nurses kept logs for 4 weeks. 67% of those nurses reported at least one episode of drowsy driving. Almost 80% of nurses that worked nights had at least one episode. For nurses that worked greater than 12 and a half hours, the risk of having a motor vehicle accident doubled. So what do we do? The simplest thing is get more sleep. So at home, maintain a regular sleep schedule. Stick to it. When we talk about a regular sleep schedule and stick to it, for those shift workers that are going in and working night shift, 7p to 7a, stick to it on your days off. I know that's very hard to try, especially if you have family and commitments outside of work. It's very difficult, but at least if you cannot maintain that schedule and you try to flip back and do a day shift schedule, at least try to stay up half as long as you would if you were on shift. And that will help coming back to work that first night become a little more tolerable. You want to ensure the bedroom is dark and quiet, as dark as possible. We went back and talked about melatonin production, that naturally occurring hormone within the body. It is only produced in the absence of light. They have found in studies that melatonin production can be affected by the luminescence of a nightlight. So we want it as dark as possible. I encourage blindfolds for folks that I talk to, and earplugs. Keep it as quiet as you can. Black out the windows if you can. A relaxing bedtime routine. This is vitally important. We want to make sure that the routine is the same, that that's taking a bath or a shower before bed. If you have problems with insomnia, that can actually cool down your body temperature over the span of about 30 minutes after you get out of the bath or shower, and that will trick your brain into thinking you're sleepy, because we also not only light and dark, but we are also actually triggered for sleepiness based on our nadir body temperature. So the lower body temperature, you get more drowsy. Nap strategically. If you cannot get good quantity sleep in one block, I worked with one physician who would sleep in blocks. He would come home after his shift, get to bed right away, and he could only get about 4 hours in before he had other commitments. So he would do that. He would be up for a couple hours, and then he would go back and sleep another 4. If working 12-hour shifts, do not work more than 4 in a row. 3 is probably best, but 4 in a row is the maximum. More than that, the increased risk of errors is just astronomical at that point. Limit caffeine, especially later in the shift. Caffeine is actually fairly good if you use it correctly. You use it early on in the shift. Most nurses I work with, including my own staff, they'll slam a pot of coffee and not think anything of it and drink it all night long. So know what your particular response to caffeine is, but for sure try to cut it off at least 4 to 6 hours before you are actually planning on laying down to try to go to sleep. Avoid bright light on the way home from work. The darkest glasses that you can. If you can get out of work prior to the sun coming up, and with spring and summer coming on, that's probably not likely for most folks. Dark sunglasses are the way to go. Regular aerobic exercise. 20 to 30 minutes of regular aerobic exercise daily, at least 5 to 6 days a week, can actually decrease sleep latency, meaning it can actually decrease the amount of time it takes you to get to sleep. It can also improve slow wave sleep, those deeper stages of sleep, where you actually the body repairs itself, human growth hormone is released, and so that really helps. That will also help with those insomnias, those increased awakenings during the night. I worked with a doctor. He said the bedroom is for 2 things. They both start with S, and sleep is the other one. And I think that's vitally important when we're talking about sleep hygiene and how we best prepare ourselves for sleep. So make that bedroom your oasis away from everything, a place to only go and sleep, and keep everything else out of it. TV, electronics, work, homework. We do so many weird things in our bedrooms, I think, but just keep that the place to go and sleep. Eliminate electronics use at least 2 hours before attempting sleep. The blue wave light form in most electronic devices, on tablets, computers, television screens, all those things, that blue wave light source can really fire up that alerting area of the brain and can also decrease melatonin production. So you want to give yourself the best opportunity for sleep. You want to make sure that at least 2 hours before attempting it, that you're getting off those devices. Keep a sleep diary, and we're going to start doing that with this project. The nurses that I'm going to ask to participate will keep a sleep diary at least a couple weeks before we start this project, to get an idea and a feel for actually how much sleep they're getting. I think a lot of nurses don't even realize maybe that they're not getting enough sleep. And by writing this all down and keeping tabs on how much sleep you're actually getting, it will allow you to start to realize where you can make some changes and hopefully increase total sleep time, improving both quantity and quality of sleep. So that was what we do at home. That's what we call sleep hygiene. Now, what do we do at work? And this is the crux of where we're going with our project in reducing nurse fatigue at Hayes Medical Center. Nap. That's the best thing we can do. Ideally, all nurses working between the hours of midnight and 6 a.m. should be given the opportunity to nap while at work. If there's insufficient staff, which is obviously a common concern, working night shift, most night shift staffs are bare bones, skeleton crews. If there's insufficient staff to allow all night shift nurses to nap, the following nurses should be given priority. Nurses with self-perceived sleepiness, and sleepiness is more subjective than pain. Pain, people have different pain tolerances. What is a 10 for you might be a 5 for me. Sleepiness is no different. Some people are really, really affected by even 15 to 20 minute swing in the amount of sleep that they get in a day, and it can really affect how they feel and how they can function. So self-perceived sleepiness is not something to sneeze at. We want these folks first in line. Nurses with driving commutes longer than 20 minutes from work or that involve highways or rural roads. vitally important when we look at the statistics from the motor vehicle accidents and those involved with shift work. These folks, we want to make sure they're awake and alert for that drive home. Nurses who have shift work sleep disorder, that is, they just have the inability to sleep well off shift at all. They just have way too many arousals. They have really bad issues with insomnia. In fact, most of these folks, if possible, should probably get off that shift and try something different. All nurses who also have sleep apnea, nurses who have insomnia or other sleep disorders or chronic medical condition, diabetes, heart disease, those types of items, they should be given priority. Nurses who work rotating rather than fixed shifts, especially those who haven't slept before their first shift or are working 3 shifts in a row. These are the folks, too, that are going to be most prone to error and most prone to accidents, including needle sticks, those types of things. So where should naps occur? Ideally, the napping environment should be private and safe, preferably with a locked door. At our facility, we are going to have 2 rooms directly adjacent from the sleep center. And it's exactly 1 floor up from the acute floor where we're going to pilot program this, and it's literally 1 flight of stairs walk, and they're right there, or up the elevator. It should be dark, quiet, and cool. Preferably, an ideal sleeping environment is between 60 and 65 degrees Fahrenheit for the best possible sleep. Be near the nursing unit, which we discussed. They should have a timer or clock, which we will have. A bed or fully reclining chair. We'll have a full-size bed, adjustable bed, and reclining chair in there, and clean linens available. How long should the naps be? A nap of 20 to 30 minutes is ideal. If you go longer than 30 minutes and you're trying to nap, there's a very good chance that you're going to go into what we call delta sleep or slow wave sleep. That's the deep stages of sleep. Very, very difficult to wake up from, and you will also experience what we call sleep inertia. It's really going to be difficult for you to get up and start moving. You're going to feel more groggy, more worn out. We actually call it a sleep drunk. So 20 to 30 minutes is ideal. If you sleep longer than that, you sure want to go longer than 90. You want to allow yourself to get through that deep stage of sleep. Usually within 90 to 120 minutes, you will have experienced your first dream cycle. Coming out of dream sleep is much easier than coming out of deep sleep. Shorter naps than that may also be restorative. Again, it's very subjective. Finding what works best for the nurse is the most vital thing. If longer naps are possible, as I said, a nap of 90 minutes allows the sleeper to complete a sleep cycle. Again, to prevent sleep inertia, naps of more than 30 and less than 90 minutes should be avoided. So what time should these naps be taken? Well, any sleep's preferable to no sleep. Anytime I give a lecture, I always start with, hey, who got 8 hours of sleep last night? And there's a few hands, very rarely more than 10%. How many got 7? A few more, 6, 5. Usually, when I'm talking to high school students, they average between 6 and 6.5 hours of sleep a night. So whoever had the least amount of sleep, by a show of hands, they get to sleep through the rest of the lecture. I'd rather they sleep than listen to me. Same idea here. But ideally, naps should be taken after midnight to alleviate sleepiness during the shift, and probably before 3 a.m. Naps taken between 3 a.m. and 5 a.m. may be harder to wake from, but they may still provide more alertness by the end of the shift. So what's the best way to prevent sleep inertia? Nurses who are significantly sleep deprived before coming to work are more likely to have sleep inertia after napping. So get sleep at home. Don't neglect your sleep at home. Compared with those who are getting adequate sleep, keeping naps short and allowing a little extra time for the sleeper to fully wake and move around before resuming duties will help. So your assignment, we'll go back to this. Determine the amount of sleep you are getting. Keep a good, accurate sleep diary. I think you'd be surprised about the amount of sleep that you're actually getting. And sometimes writing that out will really be an eye-opening revelation to you. Make efforts to improve that total sleep time. You want to, when you're on shift, at the beginning of the shift, pair up at work with a nap buddy. So you'll watch my patients while you nap. I'll watch your patients while you nap. Take frequent rest breaks while working, just sitting down. you know, just taking a break, the 5 minutes away from what you're trying to do can actually improve alertness and reduce fatigue. Learn to recognize the signs of fatigues in your partner: excessive yawning, just, you know, they look sluggish. You don't tell your partner that they look terrible, but you'll recognize, as you learn to recognize those signs of fatigue in one another, don't be afraid to tell a person, hey, go take a quick break. Take a nap, record the benefits. So what we're going to do is also have the nap time. We're going to have nurses fill out what we call a Karolinska sleepiness scale. It's a scale that's on a scale of 1 to 9, and basically 7, 8, and 9. That's where you're labeling yourself as sleepy. And the way you do that is you mark it approximately 5 minutes, how you felt 5 minutes before you started taking this little questionnaire, and then write that down. Then after the nap, we're going to have a Likert scale 1 to 7 on the benefits, how you felt you slept, if it was beneficial, and then also a place for comments so we can improve the process. We want to give nurses that are doing this a lot of buy-in and a lot of opportunity to kind of construct the program as it works best for them on their particular unit. Thank you for your attention. I know this seems like kind of an odd project. You're going to take naps, but when we look at the literature and we see that decreased total sleep time and working off shift and trying to sleep against your natural circadian and its risk for increasing patient errors and nurse health overall, I think it's vital that even small changes can make a huge difference in the overall quality and health of our nursing workforce. Thank you.